Hello and welcome. The total number of COVID cases in India is now approaching the 5 million mark, but somewhat worryingly, in cities like Mumbai, it's now over 170,000 with over 8,181 deaths. And that number does not show any immediate signs of slowing down. But the larger issue is not right now the number of cases or deaths, but the number of hospital beds and particularly intensive care units, which seem to be now under much greater pressure than they were even until a few weeks ago. So why is this happening and how is the administration responding to this? To understand this a little better, I'm joined by Dr. Gautam Bhansali. Dr. Bhansali is a specialist in general medicine and infectious diseases at the Bombay Hospital, which is in South Mumbai. He is also the chief coordinator between the civic body, that's the Mumbai Municipal Corporation, and all the private hospitals for managing the beds. So, Dr. Bansali, thank you very much for joining us. So, broadly, why is it that after a long time, or when I say long time, I obviously mean a few months, that we are suddenly seeing a sudden pressure on hospital beds, including intensive care units?
Yeah, see, if you see the graph that we were much better position in July and August, and this September month definitely we have seen a big surge in the number of cases. There are three reasons for that. One is that lockdown is almost open, plus that people are coming from different state also for the treatment for the other thing also. So because of that, or you can say it's like a second wave only, cases has increased in city like Mumbai. But why lockdown was there, that we need to understand. Lockdown was there to educate people, to give awareness to people that what is to be done to fight with this kind of disease. It's a new learning, it's a new disease, and it's a new challenges for everybody. Meanwhile, we need to prepare health infrastructure. See, our health infrastructure was not ready that time when that disease come to this country, like nearly near
Right.
March. That time we were not prepared for this disease because we need to create negative person in the ICUs in the ward. We need to have different entry, different exit for this kind of situation. Whole world is facing the different kind of problem in this time, in this pandemic era. So now the number of cases has increased. We are totally geared up with the number of beds. Yes, there was some shortage of bed in between. We closed down some nursing home 1 month back because of there was some issues with the nursing home. Like people were saying that some overcharging issues were there, and that mortality rate was little high in Mumbai. It was 5.5. After that, after shut down that nursing home, now our mortality rate is 2.6 in city Mumbai, and that issue has almost sorted out, that overcharging and all the things. But since
Right. So
number of
you're talking
cases
about those 72 or 73 nursing homes which were
nursing
stopped
home,
or right, of which I understand
yes,
now 27 have been reopened.
yes. So yesterday we had a big meeting with the municipal commissioner and honorable chief minister sir, because number of cases has increased and we assume that number of cases is going to increase in the near future. Plus, there is an influx of patients from the other state also, not only from the Maharashtra, like from the Sangli, Dhulia, Kolhapur, Nasik, Pune. All our the state cases are coming to Mumbai. People want to take treatment in Mumbai because they feel that Mumbai has a best health infrastructure, best doctors, skilled health professionals are there in the Mumbai and they will get best treatment. That's why people
Right.
are coming to Mumbai. So we need to open that 27 nursing homes which are more than 25 bed hospital, which are well regulated, which hospital they have MD doctor, critical care specialist doctor. Only that 27 hospital nursing home we allowed to open yesterday on.
Right. So, can you give me a rough sense, Dr. Bansali? For instance, let's say if you have 100 beds with you, and I'll come to ICU and non-ICU, how many are now populated by non-Mumbai people as opposed to, let's say, maybe pre-COVID times?
Yeah,
Percentage.
so now the number of patients admitted in these hospitals like nursing home and big private hospital, 30 to 40% patients are admitted. They are from outside MMR region, like they are from Bhiwandi, Thana, Kalyan, Dombivli, New Bombay, or that Ulhasnagar, or you can say that
And what would that number
Kolhapur,
be for
Sangli.
a pre-COVID? And what would that number have been, let's say, last year this time?
Last year, this time, yes, patients, people always across the country, or you can say across the world, they come to Mumbai for the treatment because Mumbai has the best health infrastructure, especially in private hospital. Medical tourism is also there in the Mumbai. So yes, definitely, you can say the 70, 60, 70% patients come from other part of the country, not only from Mumbai. But this is the COVID time, and COVID patients come more across the state, across the country. That's why we are facing, and we have particular different kind of situation for the COVID bed arrangement, bed management, and the staff is
No,
we
so
have we have
Dr.
different.
Bansali, can you explain the maths to me a little bit? So if you're saying that 60 to 70% of patients at even in pre-COVID times were coming from out of Mumbai, whereas now you're saying about 30% of patients in all are coming from out of Mumbai. So that shouldn't be a problem, or is it?
No, this is a problem because I am talking about 30 to 40% patient COVID patient. I'm not talking about a
Okay.
non-COVID patient. Yes, like I have we
So
have
and those
Bombay Hospital.
non-COVID patients are not coming now. Is that because I mean, yeah.
Yes, yes, yes. See, there was a misconception that all industries are collapsed, except hospital industries are flourishing. But the situation is that hospitals are mainly private hospitals are they are in big loss. Why? Because COVID in the COVID hospital or the COVID situation rate is capped by the government. So there you cannot charge more than that particular amount. And in non-COVID patients are not there. So hospitals are in big loss. Earlier there was a
Right.
cross
Yeah. I'll
subsidy.
come to the financial part, Dr. Bansali. So you're saying that, okay, so you're saying that proportionately today, you have a much higher ratio of patients coming from outside Mumbai, which is placing a load on the system because most of your beds or a fair number of beds are dedicated only for COVID. Is that correct?
Right, that is correct. So like in Bombay
Right.
Hospital, we have three separate buildings. One building is only for COVID, one building is non-COVID. They are three different kind of building. So COVID building is always full. Non-COVID building is now is start. People are coming for the treatment because people were in panic. They don't want to go to hospital. They feel that if we go to hospital, we will get COVID virus. That's why they were not coming. Now people are coming, but still surgeries are only emergencies or few elective surgeries are going on because there is a lot of fear in the public. No, no, we don't want to go to hospital. That's why non-COVID is not that much filled up, which were earlier in the pre-COVID era.
Right. So you're saying that if a patient were to have a non-COVID situation, then it's quite likely that they will get a bed and or for that matter, even an ICU admission in Mumbai.
Yes, 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 yes. Non-COVID are
Okay.
open. It's totally open. Beds are there. There is no problem of the availability of the bed in the non-COVID bed.
Right. Okay, Dr. Bansali, can you give us a like a top-down view? I mean, total number of beds that you are managing in a way in the private hospital space in Mumbai. What is the current
Yes.
fill rate?
So right now, if I say the conditions of the Mumbai, that private hospital, like 33 big private hospital, like Bombay Hospital, Bridge Candy, Hinduja, Lilavati, Jaslok, this kind of hospital, we have 2,600 bed, COVID bed. I'm talking about only about COVID.
Right.
2,600 COVID bed. Out of that, 1,600 beds are oxygenated bed. All bed are having oxygen. Plus, we have 590 ICU bed in this 33 big private hospital. Yesterday we opened that 27 small nursing home where we added 390 ICU bed and 1,700 oxygenated bed with the nursing home, 27 nursing home, and this is a 33 private hospital. In the government hospital, we reduce the capacity of COVID bed because we open up that non-COVID part also. In the like Nair, Sion, earlier the Nair was totally dedicated to COVID hospital. Now 50% COVID, 50% non-COVID. But we have increased capacity in our jumbo facility. We have 11,000 bed, all are oxygenated bed in the jumbo facility. Jumbo facility like in NSA Valley, BKC Dome, Nesco, Daisar, Mulund, HSL Kusar, where we have all bed are oxygenated bed. It's not a isolation center. Jumbo facility is not a quarantine center. They are full-fledged hospital with oxygenated bed with ventilator. We have all the BiPAP machine, nasal cannula machine. Plus we have X-ray, sonography, 2D echo machine. Plus we have pathology lab in each and every jumbo facility. One more thing we have added in jumbo facility, we have all kind of medication. Even you can say remdesivir, tocilizumab, all medicines, and it's a totally
Right.
free of cost in jumbo facility. One thing
Right.
we added, why people are not coming to jumbo facility? Sorry, you're asking, sir.
Go ahead. Go ahead.
Yeah. So I took a round of that all the jumbo facility, and we did a proper inspection. Why people are not coming to jumbo facility? There are two or three reasons. One thing, their perception that that jumbo facility is only quarantine center or isolation center. No, it's a full-fledged hospital. Second thing, they feel that doctor may not be good. So what we did, we all the jumbo facility will be run by now all government medical college hospital staff like Sion, Nair came. They already deployed two unit. Two unit means each unit is having 40 to 50 doctors in that hospital. Plus, all jumbo facility will be monitored by big private hospital like Bombay Hospital and Bridge Candy. They will monitor this NSI Valley Dome. Lilavati and Hinduja be a top expert doctor. They will look after BKC Dome, BKC jumbo facility. Same thing like Nesco Goregaon facility that will be looked by the Kokilaben Hospital and Nanavati Hospital.
Right.
Mulund Hospital will be looked by the Fortis Hospital. That kind of arrangement we did today only.
Right, but are there enough? I mean, again, just to go back and look, I mean, you said 2,600 beds plus and 590 intensive care unit beds in the private hospitals in Mumbai. Now, what about the number of doctors and nurses to manage this, plus the jumbo facilities that you've talked about?
Yes, see, in private hospital and nursing home, there is no shortage of doctors. And government settled the hospital, MCGM hospital, there was no shortage of doctors and nurses was at all. Only facility that staff shortage manpower you were facing in the jumbo facility. That's why what we did, we deployed the medical college hospital staff two unit in all the jumbo facility. Plus, we deployed private hospital top expert doctor for the ICU care in this jumbo facility. So from yesterday, there is no shortage of staff in any jumbo facility.
Right. Okay, Dr. Bhansali, you are an infectious disease specialist as well. So, what's your sense? I mean, looking at the patient flow, looking at the condition in which they're coming to the hospital today, what's your sense on where we are in terms of management of this disease?
See, management of the disease. See, again, I tell you, it's a new disease, it's a new challenges, and it's a new learning. Every day we are learning new things. Every day we change our guidelines. Sometimes we say that more than 50 age of the patient they should be hospitalized. Sometimes again we say that asymptomatic patient home isolation is better. So what we are seeing, the virulence of this disease. Now virulence has decreased. We are not seeing that much critical patient earlier, which was seeing in April, May, June. That time it was a horrible time. Now that much critical patients are not coming now. Maybe patients are enough educated. They are very well controlled their diabetes. They are taking enough precautions, and enough medications are available like remdesivir. Definitely that help us a lot. It will not stop that virus. It reduce the viral load. So I feel with the availability of the medications, with the availability of the bed and oxygen. Main thing is oxygen requirement is much more very important, not ventilator. Every patient doesn't need ventilator at all. Patient have the fear. The public have the fear. We should go to the hospital. They should have a ventilator. No, all patient doesn't require at all ventilator. They need oxygen. Oxygen is more and more important.
Right. And last question, Dr. Bhansali. So you're saying that most of the additional load that we are seeing in particularly in intensive care units is because of patients coming from outside. Is that likely to reduce, or could that increase? And therefore, are we back to a situation like we saw in maybe May, June, where the disease itself has not maybe spread, which it did in May, June, but just the patient load is continuing to rise?
Yeah, I feel the patient load will continue to rise till the end of this September. After that, things will settle. After that, I feel personally, it's my personal opinion, that after that first week of October, number of cases may decrease. But if again the number of cases will increase, we are totally geared up with the facilities. We have the bed, like in Jumbo facility, 30-40% beds are still vacant. In a private hospital, 10 to 20% beds are vacant. In ICUs, 1 to 3% you can say beds are vacant. Vacant means not all the time they are vacant. Vacant means the patient goes, new patient come. Patient go, new. It's like a turnover sort of things are there. But all facility, all the things, everything is available. Plus, earlier we were doing only 4,000 tests per day in Mumbai. And Mumbai is the only city, or you can say the first city in the world, who recommend that patient can do test without doctor prescription. Now we are doing every day 15 to 16,000 tests per day. We are chasing the virus. We are not worried about the number game, like the number of cases will increase. No, we
Right.
are just changing the virus. Why we should we want to decrease the mortality rate, and we are able to decrease that mortality.
Right. Dr. Bhansali, thank you very much for joining us. And as always, I do wish you and your colleagues all the very best in this fight against
Thank you, sir.
COVID-19.
Thank
Thank you.
you.